Hi, and welcome to your preoperative joint replacement education class. This is Dr. Gandusky. I'm going to bring you through some basics to understand before your joint replacement, and we'll go through kind of from start to finish what to expect and cover a lot of details. So first off, if you haven't looked at my background, I hope you're reassured that me and my team have trained quite a bit to take care of you. Thank you for choosing us for your care. I traveled quite a bit. Went to college outside of Philadelphia at Villanova University, and then went to the Uniformed Services University in Washington, D.C., in the United States Navy. And then after medical school, went to internship in San Diego, followed by a tour with the Marines in Camp Pendleton, California, for a couple years, during which I deployed to Iraq with them. And then back to San Diego for residency training, which is 4 years of training for orthopedic surgery residency. Following that, I went to Okinawa, Japan, which is the largest naval hospital in outside of the United States, and practiced orthopedics there for 3 years, and then returned to California for fellowship training. Fellowship training in orthopedics is where we subspecialize in different specialties. So I did a hip and knee replacement fellowship in Southern California, and then returned back to the Navy time in Portsmouth, Virginia, and then have been in the Jordan Young Institute in Virginia Beach since finishing up my Navy time in 2015. And I hope I have earned a good reputation in the community. We have a track record for success with thousands of happy hips and knees since 2013. So really have tried to do a lot of good work, and I think we have a good program in place to help you. It's important to know that you play a part in ensuring successful joint replacement. Total knee replacement, total hip replacement are two of the most common surgeries in America. So I think it can help reassure people to know that a lot of people are going through these surgeries. They're successful in general and people do well. And so you will be like these people who are up walking immediately after surgery, within minutes after surgery, and also later on enjoying recreational activities that you like to do that you may or may not be able to do anymore because of your joint pain. And that's the goal, is to keep you active and get you back to your level of activity that you desire. So we're going to talk about what to expect before, during, and after surgery. We're going to talk about preparing for surgery, the logistics on the day of surgery. I really want you to understand anesthesia and the pain management plan, because that's important. And I think when everybody's on the same page and understands that plan, patients do really well. And no, gone are the days where people are really miserable, I would say, early after surgery. People really have a better pain management plan put together, I think. And we use what's called multimodal analgesia to make you comfortable. And we'll talk more about that. We'll also go over some of your discharge instructions and equipment. And really understanding these basics will help you ensure you know your care plan, and being an active partner in this will help all of us throughout the course of your care. So first off, what is a joint replacement? We're basically any joint replacement, really, from a finger to a wrist to a knee to a hip, is really just resurfacing the ends of the bones with man-made parts. So with arthritis, the ends of the bones are covered by cartilage at a joint. And when that cartilage is gone, patients experience pain because the cartilage no longer allows for that smooth motion, and therefore friction occurs and inflammation happens and swelling happens and pain occurs. And so a joint replacement resurfaces the joint so that those bone ends are no longer touching. And so this is what the knee replacement and hip replacement basically look like. You can find out a lot more information about prostheses and specific aspects of this at some of my websites, as well as good websites from the American Association of Hip and Knee Surgeons and the American Academy of Orthopedic Surgeons websites listed here. For preparation for surgery, we'll do a lot of things before surgery. In the office, you'll come visit and we will talk about options for your hip or knee. And we'll start with non-surgical treatment and then consider surgical options when you are out of non-surgical options and your quality of life is being affected. And then if we agree surgery is the best option, we'll help you find a good surgery date. And that really sets the timeline for what's going to happen in the future. Before surgery, we'll get some lab work and we'll tell you when and where to get this, as well as primary care clearance, which is basically a note from your primary care doctor that says that you are okay medically for surgery and anesthesia. And then some patients require specialty clearances. So, for instance, people with significant heart disease, sometimes we will have them get a note from their cardiologist before surgery that the anesthesia team will want to see to make sure that you're optimized for surgery. We also make sure that you're optimized in terms of your health. So this includes good sleep hygiene, good nutritional status, and sometimes some prehabilitation exercises to get you ready for surgery. And then we'll talk to you about requirements for your home, as well as your home medicines. So generally, your primary care doctor and preoperative nursing will talk to you about when to stop certain medicines. And then you'll learn the required plans for not eating or drinking before surgery, as well as cleaning your skin. And then it really helps to assign a coach who can help you through the replacement process, somebody to be there with you for the early parts of surgical recovery, help you in the um, early phase at home, and be a person that you can lean on and trust to listen to providers that are talking to you about things, and be another set of ears. The medical clearance that's done before surgery is generally done by your primary care provider, and they'll give you instructions to stop or change medicines. Things like blood thinners and anti-inflammatory medicines and supplements will stop before surgery. And then we'll also make sure we have the necessary lab work completed and get any additional consults or testing as needed. Pre-anesthesia surgical screening process is a process whereby a preoperative screening nurse will generally call you before your surgery date, and they'll go over all of your current medicines, they'll review your preoperative instructions, and they'll confirm your show time at the center. Skin preparation before surgery consists of a Hibiclens wash on the night before and morning of your surgery. We really don't want you to write on your extremity, shave or clip or wax or use any chemical hair removal before the surgery on your own. We will take care of that. And these are the instructions for showering with Hibiclens. You can pause on this slide if you want to, if you need those instructions. I won't read all of these, but essentially you're going to wash um, your body only with the Hibiclens solution. It's also a good idea to get your house ready. You want to make sure you've removed any trip hazards like throw rugs, and or at least secure them. You want to store commonly used items that you get a lot, like from your kitchen and bathroom and bedroom, within easy reach to make sure you don't have to really aggressively bend down or reach really high up onto cabinets or get on stools. And you will be able to get up and down stairs the day of the surgery. So we'll practice stairs, um, and you um, do not need to generally move a bedroom upstairs, or sorry, downstairs, as long as you have good support, a railing, and take it slow. Most patients can walk up and downstairs immediately after surgery. You also want to think about food and make sure that you have some food stuffs that are pretty easily accessible, available. The day before surgery, we'll have you make sure you remove fingernail polish, put clean sheets on your bed, eat a regular meal in the evening, and then we'll go over the NPO protocol for not eating or drinking, the Hibiclens shower, and then it's nice to get a good night's sleep if you can, to come in well rested with good energy. On the surgery day, you'll arrive at the center, and before that, you'll repeat the morning shower. There's no solids or clear or non-clear liquids after midnight the day before surgery, so that's very important. Won't be able to do surgery if you've eaten in the morning. You can drink clear liquids until 4 hours before the surgery start time. So clear liquids, very importantly, include water, sports drinks like Gatorade or Powerade, pulp-free fruit juices, plain black coffee or tea. So no creamer, no milk, and that's it. That's the only clear liquids that you can take before surgery, up to 4 hours before surgery. Otherwise, no solids or non-clear liquids after midnight before the surgery. And then when you arrive, you will check in at the registration desk, and then they will transfer you to the preoperative area. In the pre-op area, they will change you into a surgical gown. We will have you meet the preoperative nurse, and that nurse will review your medical history, medications, and allergies. They'll take your vital signs, height, and weight. They'll start an IV, and they'll complete your skin preparation. We'll use some nasal swabs generally to clean your nares, as well as antiseptic skin wipes. And then we'll prepare the surgical site, as well as give you some medicines before surgery time. Also in the preoperative area, the anesthesia team will meet you. They'll discuss the type of anesthesia that is best for you. This is important. In general, local or and or spinal anesthetics with IV sedation is usually the preferred anesthetic. Spinal anesthetics with a combination of IV medicines will keep you comfortable. Most patients are asleep or snoring, but essentially, kind of like a colonoscopy, you get IV medicines and are comfortable. And then the spinal anesthetic they perform and use a needle to make your legs numb. And it's very nice to avoid general anesthesia. Results are better with joint replacement, looking at studies in terms of risks of things like nausea, pulmonary issues, heart issues, and also better blood pressure control with spinal anesthetics. In addition, the kind of groggy, nauseous aspect of anesthesia that can sometimes happen with general anesthesia is less likely to occur with spinal anesthetics. So for all of these reasons, there are better options for patients, and generally I prefer that. And if the anesthesia team cannot get the spinal anesthetic, or you're not a good candidate for a spinal anesthetic because of a large spinal fusion from top to bottom or something significant like that, then we will use general anesthesia. But in general, spinal anesthetics are preferred. And in addition, the surgeon, myself, will come by. I'll sign the operative site and answer any questions that you have. In the operating room, you will be comfortable. We really can't do the surgery if you're not comfortable. And so we'll make sure you're comfortable and perform the surgery. Most standard joint replacements take about an hour of actual surgical time, and then about another 30 to 60 minutes are needed for anesthesia positioning and preparation. So generally, it's about 2 hours or so in the operating room, and then you will be sent to the recovery area. In the recovery area, you will get ready to get up and walking. And sometimes you'll go home right from the recovery area. Other times you'll be transferred to a different short stay area or therapy area. After surgery in the recovery area, of which generally most patients are around for about 1.5 to 2.5 hours, you will get up and move and get ready to go home. So we want to see stable vital signs. We want to see you be comfortable with minimal pain. We want to make sure you can urinate and you do well with therapy. But you will be up walking right away. A lot of patients are amazed that we can do big surgeries like this and let people get up, but it is very routine, and these implants are incredibly stable and stout immediately. And so getting up and walking with a walker, full weight bearing initially, is the plan for just every single initial standard joint replacement. And you will be able to walk comfortably and should be able to mobilize right away. So we want to make sure you meet the discharge criteria, and we'll make sure you have everything you need. So we'll make sure we have a therapy plan set up. We'll make sure you have all your medicines to go home with, and we'll talk about how to take those. And then we'll make sure you have your equipment. Really, all you need for equipment from an equipment purpose standpoint is a walker. And we will give you one at the facility if you do not have one already. And then an ice pack generally will also give you. So really, there's not a lot of equipment generally needed for a standard hip or knee replacement. We're going to reinforce ways to ensure success and minimize problems. So we'll talk to you about controlling your pain, managing your dressing, which will be very easy, how to prevent complications, and then how to contact us. I do want to spend a little bit of time on pain management and medicines after surgery, because this is really one of the biggest breakthroughs in joint replacement in the past decade, which is basically better pain management for you, which allows us to mobilize you faster and better, which helps prevent complications. A long time ago, people would stay in the hospital for a long time, and they would either be numb from the waist down or they would be incapacitated with a lot of pain medicines, and that would get them off to a very slow start. They wouldn't mobilize. They'd be at higher risk of things like blood clots. But these days, with modern anesthesia and multimodal analgesia and techniques that we use surgically, patients are able to mobilize quickly and safely and comfortably. And this is what really prevents issues medically. So, lung complications, for instance, of patients not laying in bed for a long time happen much less than they used to because of how quickly we mobilize patients. And so a big part of that is a pain management strategy, and sort of understanding what we're doing with that really helps you in order to understand what we're trying to do with the medicines we're giving you, so that you know how to take them. So if you think about where pain comes from, I don't expect anybody to be a anesthesiologist or a pain management specialist who understands all these pathways. But if you think about where pain comes from, basically, you have a tissue sort of trauma. So if you have surgery or if you bang your leg, your leg hurts, right? And there's a source of trauma that's stimulated, and then that travels up through your spinal cord and up to your brain. And your brain says, "Ow, that hurts," right? So different medicines affect that pain pathway in different places. And so what the goal with pain management is to basically use multiple medicines that are benign to help pain in different locations a little bit so that no one needs strong pain medicines as much. So we rely on multiple different medicines that are relatively benign to work as opposed to just narcotic medicines that are prone to have problems. And so that's kind of what we're doing. So for instance, Tylenol works on the brain to help control pain perception. Anti-inflammatories work locally near the site of the joint replacement to decrease inflammation and decrease pain perception. Anti-neuropathic medicines affect the ability of nerves to conduct and transmit pain reception. So we're doing all these things to kind of control your discomfort. But that is what's called multimodal analgesia. And the whole goal is to utilize these more benign medicines to help control your pain and limit narcotics. So that's what this is. This is multimodal analgesia. And so what we do is during the surgery, we control pain with things like local injections. So we do injections around the surgical site about a hip and a knee to help control pain locally. And then we give you medicines like Tylenol and anti-inflammatories to help decrease pain perception and inflammation. And we limit overall narcotic usage to as little as possible in order to avoid complications related to narcotics. All narcotics at high doses or in very small people, even at low doses, can cause nausea, sedation, constipation, itchiness. They have addiction potential. So all of those bad things with narcotics make it so we really want to limit those. Narcotics are necessary after big surgery, so they do have a role and they do work and they do help, and you will need some, but overall that will be limited. And that's the whole goal behind this pain management plan that we have. Our team will actually go over a sheet with you with your discharge medicines and how to best take them. And what we do is basically tailor all of the options that we have to what's best and safest for you. So for instance, different size people get different medicines because they're more prone to some things than others. People who can't take anti-inflammatories because of kidney issues, then we consider things like anti-neuropathic medicines to take in order to help control pain because we can't give anti-inflammatories. So we're always thinking about your laboratory data, your health, your size, your medical issues, and really tailoring your pain control plan to what's best for you. But very common medicines for most people include Tylenol, anti-inflammatories, and as-needed pain medicines, and limited narcotics, like we talked about. Also, ice and mobilization help control pain, and these are important adjuncts. So we'll tell you how to ice, and we will encourage you to mobilize to move. Again, some common medications after surgery you'll go home with are things like Tylenol and anti-inflammatory medicines, medicines for constipation prevention, as well as anticoagulants. So anticoagulants to prevent blood clots are important after surgery. Aspirin is the most common one, but sometimes we use other agents for patients. And again, we risk stratify people. So if somebody has a low risk for blood clots, generally that is almost always going to be aspirin these days for prevention of blood clots. For patients with more risk factors or that are on pre-existing anticoagulants like Xarelto or Eliquis, they're going to go back on those medicines generally. And so that's what we're doing, trying to figure out the best medicine plan for you after surgery. After surgery, we want to prevent problems that can happen. So you'll read about risks of surgery, and these are some of them. And it's important for you to play a role in trying to reduce your risk because there are ways that you can do that. And obviously, these are important to prevent. So one thing we worry about are things like blood clots in the legs or pulmonary embolism to the lungs. So a very big deal. Blood clots a big deal, and pulmonary embolism is a very, very big deal medically. So we want to prevent those. So things we do, things like medicines, like aspirin or other anticoagulants, ankle pump exercises will reinforce with you. So moving your leg and squeezing your calf muscles will help move venous blood in your leg and help the stagnation that can happen when you're immobile. And also frequent ambulation. So very important. We really stress people getting up early frequently in order to mobilize and walk. With walking, every step you take, you're pushing on your calf squeezing your vessels in your leg, and that helps prevent stagnation and blood clots. So all of those things will reinforce, but it depends on obviously you getting up and doing them. In terms of lung problems, one of the biggest keys is really just frequent ambulation. So getting upright and walking makes people breathe in deep and helps prevent lung problems. But also, especially for higher risk patients, we'll really emphasize deep breathing exercises after surgery to open up the lungs. From an infection standpoint, obviously something we always worry about. The most important thing you can do is just have proper wound care based on our recommendations. In general, I like to keep things under wraps for a while, and so it's pretty difficult to really have any major wound issues that you can surface. Generally I'm going to keep a dressing on your extremity for enough time that that skin will be relatively healed. And so basically just adhering to the recommendations we have for your dressing is the most important thing, and also not soaking the area until we see you back in the office is important. Nausea and vomiting can happen, and really the key with that is limiting narcotic medication because narcotic medications are very frequently the source of that, and so the whole pain control plan is really revolves around that. And also, when you do take pain medicines, eating food can help decrease the risk of nausea when you do that. Constipation is relatively easy to prevent these days with the limited number of narcotics we give, but it was a bigger problem in the past. But in general, we're going to give you medicines to help this. Make sure you have a good soft diet and plenty of hydration, and also frequent mobilization helps get your GI system back in order. We also want to prevent falls. Falls obviously are a problem. We don't want wound issues or dislocations or any bad problem that can happen with a really significant fall. So stay safe, making sure that rugs and other trip hazards are away from you. And also prepare your home and make sure anything that looks like it could be a problem is remedied before surgery. At home, it is nice to have somebody available to assist you. And so, like we talked about earlier, it's nice to have a coach who's going to be around to help you after surgery. Um, we're going to send you home with medicine instructions and how to take those. We're going to make sure that you understand that we want you to mobilize walking frequently. It's good to think about your nutritional status because you're trying to heal a pretty big surgery, and so your nutritional status is a good way to ensure that you have a healthy body to help heal incisions and recover from surgery. So make sure you're eating well, and then practice good sleep hygiene. Sleep is very important. It's very common to have some sleep pattern issues after a big surgery like this. It has to do with the stress of surgery and the medicines you're taking and the recovery and the changes to your daily routine. So it is fairly common to have some sleep disturbance, but it's important to have good sleep hygiene, which basically means that you want to try to wake up at the same time every day, go to bed at the same time every day, not nap during the day, not drink caffeinated beverages before bedtime. All those things that are kind of straightforward, simple things that you can do to maintain good hygiene, and that does get better with time as you get further out from surgery if you do have any sleep issues. We also are going to make sure you understand your physical therapy plan. So we'll review your goals, and generally we'll make sure that um, that we want to help you mobilize. For a hip, really, it's all about getting around and mobilizing, and therapy should be relatively easy. For a knee, therapy is actually much more aggressive. We really want to make sure that you work on motion because motion is really important after surgery with the knee replacement. And ultimately, your long-term motion is really dictated by how much you get early on. So the early therapy plan with a knee is going to be mobilization and motion, and then later you're going to work on strengthening. So afterwards, we'll set up your physical therapy, and there's a bunch of different ways we will do this. Really just tailored to what's best for you. Sometimes we'll do self-directed therapy exercise at your house. There's a nice website. The American Association of Hip and Knee Surgeons has some good preoperative and postoperative exercises before hip and knee replacement that are kind of nice, simple go-bys with some videos as well that you can look at. Also, sometimes we'll send a home health therapist to the house to start working with you. Otherwise, we'll utilize sometimes outpatient therapy and have you go right to an outpatient therapist. And sometimes we'll do this in conjunction with what you want to do. So, for instance, sometimes patients just really love their outpatient therapist and want to go early to outpatient therapy. So we can make sure that the plan works for you, basically. We do start really everybody with a walker initially because it's the most stable thing to use, and really we just don't want you to fall after surgery. So even though patient ranges are pretty significant mobility wise and age wise, and walkers seem kind of unusual for a younger person to use, they are the most stable thing to use. And so we do start everybody with those. And especially younger, healthier people that are very mobile will be off that incredibly quickly, generally within days, and then transition to a cane, and then off everything. This will be guided by your therapist. There's some good sites for more information about hip and knee replacement. My websites you can look at. There's some frequently asked question sheets that we have that answer more questions that are commonly brought up around the surgery time period. Also, the American Association of Hip and Knee Surgeons website, of which I'm a member, is a very good site that looks at both pre-op, post-op exercises, as well as a lot of good information about hip and knee conditions, treatment options, and replacement itself. The American Academy of Orthopedic Surgeons, as well, is a good website. That's orthoinfo.org. That has a lot of good information about really all orthopedic conditions, everything from spine issues to wrist issues to knee and hip issues. And so you can get some good information there about multiple conditions that affect people. I would just remember to trust objective websites from good sources and avoid sites that are really biased. A lot of things, if you really look at them from the internet, are really trying to ultimately sell you something. And other sites that try to promote themselves have incredibly anecdotal information, like pictures of patients that are doing well, but not a lot of real results or tangible things. And so I would avoid sites without real evidence and also non-trusted sites. But so things like this, these organizations of which I'm a member, are very good, trustworthy national sites that really provide some good patient information. If you get in touch with us after surgery for routine, non-urgent questions, please call the office. There's somebody on call after hours as needed for anything significant. Otherwise, please call during routine hours for anything that you need for non-urgent issues. For any obviously urgent issues or emergencies, call 911. Well, thank you. Hopefully, you found this talk useful of getting ready for your surgery and surgery time period. Please refer to it when you are recovering as well for any tidbits that can help you. It really is a process to get better from a hip and knee replacement. It does take a little bit of time, and the best results are really obtained with a good surgical team and a good partnership with you to make sure we're all on the same page in order to work to achieve a good result. So we're here to help you through it, and I look forward to taking care of you.